ハロー。今回は私の友人の K さんに SSRI の服用についてインタビューを行ったのでご覧いただきたいと思います。 K さんは脳神経学の研究をしている方で MD メディカルドクターの、称号をお持ちです。医学博士っていうやつですね。で、インタビューの中で彼がコメントしている内容は結構ね、科学的なとか医学的なその根拠に基づくものになっています。本名は伏せたいと思うのでK さんということでご紹介したいんですけれども、彼はスイス人の方で、とってもね素敵なジェントルマンです。パニック障害がいよいよ深刻な状態になってきた時に、その時はねまだベンゾ系の抗不安薬しか飲んでなかったんです。医師からそろそろ SSRI に切り替えてみてはどうだろうっていうふうに打診は何度か受けていたんだけれども、昔ねその10代の頃にパニック障害を患った時に私どっちも飲んでたの。 SSRI も飲んでたし抗不安薬も飲んでいた。でその時のなんかイメージが残っていて、ですごくやめにくい薬っていう風ななんかイメージがあったんだよね。それでものすごい戸惑ってしまって、その時はもうパニック発作がいっぱい出てもうピークの時だったから、不安感っていうのがほんのちょっとしたことに対してもものすごい膨らむっていう、そういう時期でした。なので SSRI を服用し始めるっていうのにねものすごく勇気が必要だった時期なんです。でも SSRI に切り替えた方がいいような気がするっていうのがいろいろネットでね情報を調べて、そういうふうに思ってはいたんだけれども最後の一歩が踏み出せないっていう、そういう状況で、そんな時に相談に行ったのが K 氏の元でした。でとってもねその彼のアドバイスが参考になって、で最後の一歩を踏み出す勇気になったのね。なので SSRI を服用したいんだけど迷っているとか、今抗不安薬を飲んでいるんだけどパニック発作がなかなか減ってくれないとかね、そういう人の参考になればいいなと思って今回インタビューをすることにしました。でね、ケイ氏素敵な人で快くうんと言ってくれました。ケイ氏は研究者なんだけれども趣味をいろいろ持っててね、写真撮影だとか、あと焼き物の趣味っていうのを持っていて、毎週末ね先生の元に行って焼き物をしているそうです。焼き物のクラスに参加しています。なのでこのインタビューの最後に焼き物の、ご紹介もしたいと思います。見てください。これもね彼が焼いた花瓶になります。でこの模様もね彼がつけたの。私この模様すごく気に入ってるんだよね。この青いなんか藍色みたいな色、これをね彼使うの結構好きなのよ。はい、前置きはこのぐらいにして早速インタビューの様子をご覧いただきたいと思います。どうぞ。 Okay, so thank you so much for
You're very welcome.
giving me this opportunity. So question number one, last time when we talked about SSRI, when I had this trouble, I was surprised you're quite familiar with anti-anxiety agents such as benzodiazepines. Will you talk roughly about why you are so familiar with anti-anxiety agents?
Or at least especially the benzodiazepines, yes. So I work as a neuroscientist. I investigate networks in the brain, how they communicate. And an important part of this communication is inhibition. So certain neurons in the brain have the task of dampening activity. And if you lose the function, or if you reduce the function of these neurons, all sorts of bad things can happen. In the most extreme case, you have an epileptic seizure, for example. These dampening or inhibitory neurons, they work through a number of very specialized receptors, an important one of which is the GABA A receptor. GABA because it's gamma aminobutyric acid, shortened into GABA, and it's one class of these. And it turns out that there are a large number of drugs that interact with these receptors, in most cases making them a little bit more active. So basically helping these dampening neurons to dampen overactivity. And one very, very important class is the benzodiazepines. So benzodiazepines help with this dampening activity. When they were discovered, it was not really clear how they were acting, which is something that is true for a number of drugs that we use for, let's say, disorders in the sort of neurological, neuropsychiatric domain. Many of them were discovered before it was clear how exactly they acted. And we know now how they act, but there were still many things that needed to be investigated. And I was part of some teams that were doing this investigation. And the benzodiazepines are relatively well known to reduce anxiety. We think because, again, they help to dampen hyperactivity in certain brain areas. And I was part of a team that tried to figure out how exactly and why exactly that is. And that's why I'm familiar with benzodiazepines, although I myself never used them. Well, I did, but in an anesthesia setting. So this dampening activity gives you some muscle relaxation, gives you a sleep-inducing function, and so on. So these benzodiazepines have a relatively broad spectrum in which they can be used. But anxiety is one very, very typical and frequently used indications for benzodiazepines. And that's how I was, sort of in this area of research and in this area of...
Well, I didn't know at all when I originally went to ask some advice. So I went to the right person.
You always need advice from many people and kind of integrate it all. I am glad if I can contribute to some questions you had.
Okay, I see. That's why you know a lot about benzodiazepines. Then question 2. The primary reason of asking your advice when I visited your office at that time was that I was so much afraid of depending on it and the side effects. I went to your office to decide whether I should take SSRI and quit benzodiazepines. That could work probably better for me in my case as a panic disorder. But I was so much afraid of taking SSRI because I once took it when I was a teenager, and I thought I remember as difficult to quit SSRI. But in the end, by talking through with you, I figured, okay, it was benzodiazepine that took longer time to quit than SSRI. Your advice at that time was really helpful for me to decide, okay, I should take SSRI. Will you explain, and it's a long time ago, so you probably don't remember the whole thing, but especially about with comparing to taking SSRI or anti-anxiety agents such as benzodiazepines, let's say. So which is more, easier to quit when we want to quit. That's the first thing we probably are afraid the most as a patient. When we start taking the pills, we feel like, okay, am I gonna take forever? Because some people say this is very difficult to quit, and sometimes it can be very, very almost like an addict, addictive to the pills. And when we have anxiety issues like panic attacks and panic disorders and everything, people start to afraid of so many things and exaggerate this fear and everything. At that time, I was like that, and your advice was really helpful to defeat that fear.
Yeah, so the answer may be a bit longish, so we'll see. But I think the first thing to keep in mind in all of these discussions is that we don't fully understand where an anxiety disorder, for example, comes from. And
what it comes from means?
In terms of, what precisely the mechanism is in the brain that makes somebody react more anxious versus somebody who reacts less anxious. We are trying, and that was part of my research a little bit, to get closer and closer to an understanding, but that is fairly far off. So the treatment is then always what we call symptomatic, meaning that we propose a drug, and we know that this drug has helped other patients, but in many of these cases, not all of them, we just know that some patients react well and others may not react so well. And it's based, of course, on an understanding of some of the brain circuitry, but the understanding is not perfect.
Okay.
That means that it is difficult to make general recommendations to anybody, and it's very important that whoever is confronted with these problems and whoever has to decide these things, that they find people who can talk with them, who can understand them, and who have the patience to go through sometimes a relatively complex process to find the ideal treatment for somebody. So when I now compare SSRIs and benzodiazepines, that's at a very general level. It may not be true precisely for each individual person. That it's very important to keep that in mind. Bluntly speaking, it is quite possible that for some person a benzodiazepine is the ideal treatment, for what ails them, for the problem that they have, and for other people it is not. And for the general observation is benzodiazepines can and do produce dependence, meaning that your body sort of adapts and your mind adapts to the presence of these drugs. And that also means that very often the dosage that you start with, you kind of adapt to that, and therefore you need to increase the dosage to have the same effect that you had initially. And this is something that makes us worrisome, that is clearly something that is less than ideal, but it's a feature of benzodiazepines. And the other thing is, of course, that also in your mind you may become dependent on taking this drug. You may have a strong dislike of not taking it. And that is known for benzodiazepines. It's something that was not so well known and maybe also not so much in people's minds when these drugs came out initially, because when they were discovered and then introduced to the public, benzodiazepines replaced a very dangerous category of drugs, the barbiturates. You always have to kind of keep the history of these things in mind, because looking back you think, well, how could they possibly overlook this potentially serious effect? But for them the alternative was a very dangerous drug like a barbiturate, which is easy to overdose, which was frequently used in a suicidal setting and so on. And benzodiazepines are very, very safe in this regard. So people focused on that.
Okay.
But then later it was discovered that they have indeed these issues with addiction, with dependence and so on. And again, this is very important. It doesn't affect everybody the same way. Addiction and dependence are very uneven in how they affect people. It's the same with alcohol. You know, very, very, very many people consume alcohol, and a sizable fraction do get addicted, but by no means everyone. You should be, and whoever is your partner in this endeavor, whoever is prescribing them, should be aware of these issues. Your questions about this, your concern was very reasonable. It is reasonable to be concerned about these things. It is reasonable to ask questions. It is reasonable to not just blindly go forward. But it's also reasonable, of course, to always weigh the risk of doing something with the risk of not doing anything.
True.
So the idea is never that you treat somebody who is leading a completely balanced and happy and sorted out life. We don't discuss benzodiazepine or SSRI treatment in this context. It's very, very obvious that the person doesn't need it, and there even a relatively mild risk of addiction or other side effects would outweigh the fact that they get no benefit from this. However, somebody who is suffering from an anxiety disorder is in a serious situation. It is not something that is helping you leading a good life. It's an impediment. It is a hindrance in many, many aspects of your daily life. And you need to weigh the risks that you enter in your treatment against the potential benefit you may have. So the SSRIs have a somewhat lower risk profile, I would say, in terms of dependence, in terms of some other side effects. They may affect another component of a patient's life, and it is very, very important that the patient herself or himself, and then but also the caregiver, pay very close attention to these things occurring. And you know, a decision to take a drug is not something that you just take and then you let it run. You always update this with what's going on right now.
Right.
It's possible that initially you don't have a side effect, and that side effect then shows up, and that means you reassess the treatment. Or it's possible that you have a side effect, but it is again weighed against the benefit that you get. It's a side effect you tolerate, but it's entirely possible that in the future the very same side effect becomes intolerable, and then you reassess the treatment. As far as I know, I'm not as much a specialist of SSRIs as I would maybe be of benzodiazepines, but again, their side effect profile from a dependence standpoint is lower, and as far as I know, the discovery that they are useful in these, especially panic attack anxiety disorders and other anxiety disorders, is basically by, again, simply observing symptoms of patients. We don't really fully understand how they really work on a, let's say, molecular level or so, but we know that there are enough patients out there who can potentially benefit, that it's worthwhile discussing it with a patient and then occasionally prescribing. So yeah, I'm trying to remember how exactly I tried to phrase it then, but let's say if you brought the same question to me now, I would emphasize that the risk profile is fairly good, and B, at that time at least, you seemed very troubled by the state you were in.
Yeah.
There was a lot of suffering, so that means there was, as far as I could judge, an unmet need, something that needed treatment, and the SSRI seemed a good option.
Yeah.
But again, you know, if a few weeks or month into this you reassess the situation and you say, no, this, you know, the side effects are too much for me, or maybe other circumstances have changed, you definitely can and want to reassess this. Yeah, I definitely want to be very careful in terms of reassuring you that it's definitely a reasonably safe and appropriate treatment for the state you were in, and at the same time acknowledge the valid respect you had for the potential downside of the treatment. Yeah, the main thing that helps in these cases is to develop a kind of trust and then, you know, go on the journey together. I think your treating physician also helped, and I guess you could have a good relationship with them. I think this is really crucial. I mean, there are a lot of differences there too. The way a patient reacts to a certain way of interaction, it can differ. So somebody can have a very good reaction and a good interaction with a certain doctor, and somebody else may be be taken aback by them. So that again also means you need to find a setting and circumstances that you are comfortable in, and then you can go forward. Then I think in this relationship of trust, the specific medication is something that you discuss and then decide on, but you will always know you can change your mind because of things that were unforeseen, or, you know, so the relationship is probably more important than the exact prescription that you get.
Could be true. Yeah.
I think so, at least.
Yes, I think so too.
Okay.
You know what? You pretty much covered everything you said at that time.
I see. Okay, so at least I haven't changed my
I remember
thinking.
Most of the things that you said, and you first you really made sure of me that every person react in a different way, and some people had a very nice life after taking SSRI.
Yes,
and
so
some people discovered like almost I'm not me anymore. You know, totally different persons, and hated taking SSRI.
Yes.
So you started from there, and today you started almost the same.
Okay, that's
spot,
good to remind me. Yeah. Okay. So and that's just to add to this. Of course, people react differently. Some people react, again, as you said, some people think, you know, that's not me anymore, I don't want this, and that's a very, you know, that you need to start discussing and you need to find solutions. But it's also, of course, that SSRI is a very broad class of drugs and substances. So, you know, if you hear from somebody, oh, I took an SSRI and it was horrible and I didn't like it, sure, that's a piece of information to keep in your mind, but it may not apply to you because A, you may be a different person and you may be suffering from a somewhat different situation, and B, the exact substance that that your friend may be referring to may not be what you are considering as a treatment. So that's actually one of the reasons I was very hesitant to make blanket statements. I think, again, if you compare benzodiazepines and SSRIs, both can help a particular person. Very often you cannot really predict whether they will or not until you've tried. But that also means that if you, for one reason or another, consider these things not working at all, you're well within your rights to raise that issue, to say, look, this is not to my expectation, and then to discuss it and to discuss a way forward.
You say that too. You could try. Until trying, you have no idea what is happening to you.
That's
your case. And if you don't like it or you hated it, you can just slowly taper off and finish. Taking, the term is shorter, then easier to taper off and shift to different medications. So that's exactly what I believed and started to, it's always nice to hear that, not like this is the medication and you have to take it for like 1 year, but instead you have the right to say, this is not for me, and I will look for different options. And
this is, I wouldn't say unique to this kind of problem and challenge, but it's very, very prominent. So if you have an infection, usually the choice of antibiotic is reasonably clear, although there as well sometimes, until you exactly find out, but there are reasonably objective criteria. You can also try to isolate whatever bacteria are causing the infection if you can, and then you can test and you can say, okay, this is the most appropriate antibiotic. It is much less so in challenges in the, let's say, neuropsychiatric category, because it's very, very difficult to predict. On the other hand, again, that gives us the freedom to say, okay, you will probably fit a certain category of patients that have been helped by this and this substance. You're in a situation where you need help, and we will try this and see where it goes. I think that's an appropriate strategy in this case.
Okay. Well, thank you for answering the question. And the next question is, this is my case. I've been taking SSRI thanks to your help, and of course my husband and myself. Thanks to all of that, I've been taking SSRI for...
and definitely give yourself the credit you deserve. In the end, the decision is yours. So you overcame that situation, and that,
It's so true,
So, give yourself the credit that is due there.
I did
it's important.
Hard decision, I think. At that time, it was really, really hard. Although it's strange, if I think about it now, definitely easier for me to try any type of new medicines compared to at that time. So, because my anxiety level decreased.
Right. It's, of course, that is maybe a bit special, but not necessarily unique. But an anxiety disorder, of course, can make you even afraid of the treatment. So even the thing that may in the end prove to help you get rid of the issue may at the beginning seem like something very, very daunting. And so I think, again, that's why then a relationship of trust and maybe hopefully even a network of trust is very, very useful, that you have people who are concerned about it and who will do what is necessary or contribute what is necessary to help. But then again, the final step is yours.
Yes.
Yes. Yeah.
Sure. And yeah, so taking 2 years, and now I'm trying to reduce dosage. It's not totally like taper off and trying to be zero, more like full pill to like half pill type of thing. Will you talk about withdrawal symptoms of SSRI, like how hard it is compared to the anti-anxiety agents such as benzodiazepines in terms of withdrawal effects?
So I have to admit, there I'm really not a specialist. I can really only give you very general feedback. So again, benzodiazepines are, because they are potentially, that you cannot just make a blanket statement that they are addictive, but they are potentially addictive. So obviously that makes tapering off and then even a complete stop of a treatment makes it difficult. Another thing is that many of them have a tendency to be quite long in your body and to have what's called active metabolites. So your metabolism, of course, works with the drug, and benzodiazepines are known to be quite resistant to that, so they stay in your body for quite a while. And then even if the body tries to chemically modify them to get rid of them, some of these metabolites are what's called active, meaning that they still have a drug-like effect.
Even though you don't have the drug anymore in your body.
Even if the original substance is kind of gone, you have, you have child substances, you have, and these can, not always, but they can have still biological effects. And as far as I know, that is more pronounced with benzodiazepines than with SSRIs. And I also, again, as far as I know, think that the potential to cause an addiction is lower with SSRIs than with benzodiazepines, which both would make it less complicated, less demanding to decide, okay, either because I want to know how I fare without a treatment. I think that's always a fair thing to ask. Once you've given in this case, the SSRI treatment enough time, it's perfectly adequate to ask yourself, well, how will I be without drug? And then to try. And again, these decisions are not carved into stone. These decisions are always decisions that you can come back on, and if you realize that either right away or maybe a year later, then you come back on it. Trying to taper it off and trying to maybe even go without any treatment for a while is absolutely no, because so especially in an anxiety disorder, I strongly believe that you can kind of learn from overcoming situations. You can learn from confronting fears. You can learn that things, that's why I also insisted that you take credit for this. You can learn that you have agency. You can learn that you can overcome things, and that may make the treatment, which was initially very necessary, that can make it less necessary. Simply because of that. Because of course, again, we don't fully know what happens in the brain to make you anxious or not. But what we know is that the brain is very plastic. Things can change in the brain. The brain has many, many adaptive mechanisms, and these adaptive mechanisms, sometimes they work against you. You can learn to become fearful in a certain way. You can, a post-traumatic stress syndrome is basically you undergoing a very traumatic experience, and from that traumatic experience you develop coping mechanisms, you develop strategies that are, once the danger is gone, working against you. But on the other hand, you can also develop strategies that are beneficial, that work for you. And of course, it's easier to develop these strategies in a state where the anxiety is not so strong that it impedes your daily life. The original question was basically, what is it to taper off an SSRI? Again, with a lot of caution, my information is that it is maybe a little bit less difficult than tapering off a benzodiazepine.
Okay.
Again, may vary very much between persons, and observe yourself and observe what's happening, and you can always come back to the decision. And again, ideally you take this decision in a network of people you can trust and who support you.
Yeah, right. Okay, thank you. And for this topic, the final question.
Okay.
Will you talk roughly about, maybe you already talked, but the positive and negative sides of SSRI?
The positive effect are that some patients are greatly helped by SSRIs in their, in their suffering.
Yeah.
And that's, again, you never weigh these things in a vacuum. You always have to weigh against the problems that you're facing at the moment. And to use your example, you were suffering quite a bit.
Yeah.
And the good thing about SSRIs, the positive thing about SSRIs, is they can alleviate such suffering. Not in all patients, not in all cases. And so again, this simply needs, there is no way around trying, but they can help a lot. They can help patients with depression, and again, there some patients are resistant to SSRI treatment. Some patients react well, and so the crucial thing in any of these treatments is to find people who you can trust, who you know will react well to you, who know you, who will listen to you and kind of go that path with you. No treatment in the world, no actual treatment is without side effects, and that's certainly the case for SSRIs. SSRIs, just as they can help some patients really well, they can have intolerable side effects for other patients. And these side effects can range from bodily disturbances that become intolerable. You can suffer from vegetative disorders, which means that the processes that usually regulate your body, that make you able to eat and breathe and your heartbeat and so on, this can become dysregulated, but they can also affect your psychological well-being. They can make you feel not the same person as and your first encounter with SSRIs, the one that you remember negatively, that may have been one of these cases where you simply didn't tolerate it well. I had one friend a long time ago who was fighting with depression, and who did undergo a trial with a certain SSRI, and she basically described it to me as she was losing the kind of remaining emotion that she had, and she preferred, but again, this is very, very personal and very individual, she preferred the sadness that she had to not feeling anything under an SSRI. So these are all things you need to weigh. You need to understand it is difficult to predict what beneficial effect the SSRI will have. It is difficult to predict what negative effect the SSRI may have. And that's why, given a certain circumstance, it is worth the risk to try an SSRI. But as soon as the assessment says, well, you know, I'm either not getting the benefit that I am expecting, or I'm not getting, I'm suffering from negative side effects much more than I anticipated, then you reassess the situation, then you do that. But this has to be done, in my opinion, on a very, very highly personalized level. And so personalized and situational level. It may be that the very same treatment and the very same side effect is tolerable in situation A, and for the same person, you know, a few years later down, it becomes intolerable. Or it could be the other way around. It can be that the first experience that you have, to take your example, for example, that the first experience that you have was negative and you had to stop taking it. That doesn't mean you cannot try a few years down the road, maybe a different SSRI, but maybe also your situation has changed enough that you can tolerate it now.
I totally hear you. I totally.
Okay.
Yeah. I can really associate with my experience.
Yes, I think you know, and it's good that you tell, you know, whoever wants to hear and wants to listen to it, these experience that you have, because I think it's important that people who suffer from similar things, that they also know that they're not alone, and they're not fighting this alone, and the more information you can get, and especially, you know, in your case, very positive experience in the end.
Yes.
That I think that's worthwhile hearing.
Thank you.
I think so.
はい、いかがだったでしょうか。結構ね、長いインタビューになってしまったんだけれども、ものすごく親切にいろいろと答えていただいたと思います。でこの相談に行ったのがね、もうかなり前なんだよね。かなり前なんだけれども、その相談の時に回答してくれたのとほぼほぼ同じような回答が今回も来ました。はい、なのでとっても参考になる回答、一貫性のある回答なんじゃないかなと思っています。でこのケースには別のインタビューもしました。なので、その別のインタビューもまた別の動画で近日中に公開させていただきたいと思います。でこっちのインタビューに関しては脳の構造っていうのは大人になっても変化することができるっていう、そういう感じのインタビューになっています。その小さい頃にね、経験とかでその脳の構造が固まってしまってもそれ以上変化できないんじゃないかっていうふうに結構言われていたのね、ずっと。最近になっていや大人になってもその脳のニューロンのつながり具合とか発展の仕方とか、そういうのが大人になっても変わることができるんだっていうのが今どんどん研究で分かってきています。でそれをインタビューしました。はい、こちらもお楽しみください。近日中に公開予定です。じゃあ今回はこの辺で、またね、バイバーイ。